Good afternoon and welcome to the May 4th Community Update. My name is Stacy Wood and I serve as a Public Information Officer here in the Emergency Operations Center. To ensure that everyone has access to the same information, the Emergency Operations Center continues to provide a range of information on the buncombecounty.org website and through these community updates in multiple languages. This community update is being aired live in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Today's updates will come from Dr. Jennifer Mullendore, Buncombe County Medical Director and Interim Public Health Director, and from Fletch Tove, Buncombe County Public Health Preparedness Director. And we'll get started with an update from Dr. Mullendore.
Good afternoon. As of noon today, there have been 79 lab-confirmed cases of COVID-19 in Buncombe County residents and 4 COVID-19 associated deaths. We expect our case count to continue to rise as we see an increase in testing and as restrictions on activities are relaxed in the coming weeks. Over the last several days, we have seen an increase in the number of cases in individuals who identify as Latinx. Transparency and accessibility continue to be important values in our COVID-19 response because we know it can save lives. We have provided most, if not all, information in multiple languages and are working with partners in our community to respond to emerging trends. As I announced last week, data about the number of COVID-19 tests performed on Buncombe County residents is available on the county's online COVID-19 data dashboard. This data now includes testing conducted in-house at Mission Hospital. At this time, providers have conducted over 2,700 COVID-19 tests on Buncombe County residents since the start of the outbreak. At the federal, state, and local level, there have been discussions about what number of tests need to be performed in a community. Most of these discussions have focused on getting a certain percentage of the population tested, typically anywhere from 1% to 5% of the population. However, the current guidance from the CDC and state prioritize testing of individuals who have symptoms of COVID-19. At this time, we do not know how many symptomatic individuals we have in Buncombe County. In order to get a better idea of the number of people in our county with symptoms, we are asking county residents who have symptoms of COVID-19 to use our symptom checker, our self-checker. Since its launch on Thursday afternoon through the end of yesterday, 237 individuals have completed the self-checker. Several of those individuals were directed to seek care and get tested based on the symptoms they reported. We will be following up with those individuals to see if they were able to get tested and to assist them as needed. So we encourage those of you who have symptoms of COVID-19, which again, I announced last week there was an expanded list of symptoms, to now include cough, shortness of breath or difficulty breathing, fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. So if you have any of those symptoms, we encourage you to visit Buncombe County or buncombeready.org and click on the COVID-19 self-checker button to use the self-checker. You can also call the READY team at 828-419-0095, Monday through Friday, 8 a.m. through 5:30 p.m. There are resources to assist with a range of language needs. The purpose of the self-checker is to make sure that you are getting connected to the level of medical care you need based on your symptoms. And again, we encourage anyone who has symptoms of COVID-19 or thinks they have COVID-19 to take the self-checker. We've received a couple other testing-related questions that I'm going to answer here. One asked if Buncombe County was performing post-mortem tests for COVID, meaning testing on people who have died. Yes, when we have requests from medical examiners who contact us requesting testing on deceased individuals, we provide them with testing supplies and send the collected specimens to the North Carolina State Laboratory of Public Health. Another question asked if the county has paid for any COVID-19 testing to date. Yes, the county paid for the testing that was conducted at the 3-day community specimen collection event. And the county is planning to request state or federal reimbursement of this expense. So again, we want people, even though our message in the past has been if you have mild symptoms of COVID-19, stay home, the message is different now. And the message is, if you have any of those symptoms of COVID-19, we want you to reach out to a healthcare provider, do our self-checker, and get tested for COVID-19. We want to know who in our community has symptoms and who in our community has COVID-19. And we are working hard to make sure that there are no barriers to getting tested if you have symptoms. Testing is available regardless of race, income, gender, ethnicity, citizenship status, or religion. And we're pleased to say that more providers are offering testing for COVID-19 if people have symptoms. We know that several of the urgent cares in our community who have stepped up to offer testing are not seeing an influx of people. So again, if you are symptomatic, please do our self-checker, call your healthcare provider, call local urgent care, specifically Mercy Urgent Cares and Range Urgent Care, and get tested. If you have private insurance, payment should be covered by your insurance company. If you are uninsured, many providers have registered with the federal government for reimbursement that would cover the cost of your visit and testing. Additionally, some providers offer charity care or sliding scale discount options for payment. So check with your provider about these details. We've also gotten some questions from employers who want to make sure that their work environments are safe for employees and their families, and who are looking for testing for their employees. We appreciate your desire to do the right thing. When you think through your work environments, the guidance is similar to what we've been promoting to the general public. Are your employees or those they work with in close contact to one another, which again is 6 feet for a period of 10 minutes or more? Are there adequate hand washing stations? And are your employees wearing cloth face coverings and physical distancing themselves to the greatest extent possible? These actions are critical to reduce infection, and it is important that all of us take them to heart when standing against COVID-19. Again, no matter if you're at home, walking in your community, getting groceries, or on a job site, it is critical and important to continue to take precautions to reduce your risk of getting or spreading COVID-19. So again, keep your physical distance and limit contact with others outside of those you live with. Wash your hands with soap and water for 20 seconds. Monitor yourself for symptoms daily. Wear a cloth face covering when you are out in public. And clean frequently touched surfaces with approved disinfectants. Thank you and stay safe.
Good afternoon. I'm Fletcher Tove, Buncombe County Public Health Emergency Preparedness Director. This morning, Governor Cooper announced that he may be able to give us details for phase 1 of reopening as early as tomorrow and no later than Wednesday. It appears from these and other indications that the state will indeed be going to phase 1 on May 9th. As these details and specifics come to us, we will be assessing them with the intentions of giving a very clear picture of what phase 1 will look like for Buncombe County at our next community update on Thursday afternoon. I will now address some questions we've been receiving from the media. Governor Cooper said last week he was optimistic that the state could enter phase 1 of the reopening process May 9th. Is Buncombe ready to do the same? Yes. Our intent is to step into phase 1 in sync with the state. It's hard to give much more information than that until we get more specifics from the governor about the details and nuances of phase 1. But as we get that information tomorrow, we will be able to present a framework for everyone on Thursday afternoon. Do you have concerns about a second wave of infections? Yes, of course. We know that as we increase testing and loosen restrictions, we will undoubtedly see an increase in cases. The goal is to slowly reopen in a deliberate and methodical manner so that the increases in cases is manageable and never overwhelms our local healthcare systems. We will be monitoring our case count and other important data trends and metrics very closely to anticipate any surge. It's very important for everyone to understand that the fact that we will be slowly reopening does not mean that there is a reduced threat. Everyone needs to continue to observe public health guidance concerning physical distancing, hygiene, and sanitation practices. They have always been and continue to be our best tool in slowing the spread of COVID-19. If the reopening process starts and there is a spike in cases, what does the plan for re-implementing restrictions look like? It will look different depending on what phase we are in. Fundamentally, the only difference between where we are now and what we expect phase 1 to be is an allowance for limited retail operations. If we start seeing a surge of cases in phase 1, I would expect for the governor to extend that phase past his initial 2 to 3 window, meaning that we could be in phase 1 for 4 to 6 weeks instead of 2 to 3 weeks as predicted. If the surge looks significant enough to possibly threaten the capacity of our healthcare systems, we would first look to once again restrict all non-essential retail and possibly clamp down on mass gathering guidance again. Finally, Weaverville withdrew from Buncombe's Stay Home, Stay Safe declaration on Friday. Can you respond to that decision and how might it impact the rest of the county? So if Governor Cooper moves us into phase 1 as predicted this weekend, then those distinctions will no longer exist, and we intend to step into phase 1 when the state does. Thank you.
The uncertainty that comes with a global health crisis like COVID-19 challenges everyone's ability to cope. The American Red Cross offers a free course for psychological first aid, including how to recognize and manage stress in yourself and in others, and how to lend support to family members, friends, and coworkers during the COVID-19 outbreak. A link to this training can be found in the chat section of this Facebook live feed, or by visiting the American Red Cross webpage. And as we continue to engage with a range of sectors around the COVID-19 response, we encourage you to tune in to hear the next edition of Let's Talk About COVID-19 on May 6th from 3 to 4 p.m. on WRAS 100.7 FM. Contributors include a range of health experts and community members focusing on what it means to be high risk during COVID-19. The next community update will be provided on Thursday at 2:30 p.m. Thank you for staying engaged as we work together to slow the spread of COVID-19 into our community.